Okay, hello. We're going to talk about soft relines today. Joy is gracious enough to let us use her as a human guinea pig here. This is the first time we've done this procedure, so we're just going to experiment on Joy. That's not true, Joy. We have done this before.
I'm a believer. Go ahead.
Okay, so the procedure is first you have to just check before you do a soft lining, and usually you do a soft lining after you've done some extractions or perhaps placed implants and the tissue's healing, so the fit of the denture is changing. Of course, the fit of the dentures always change, and they never stop changing even after the final hard reline is delivered, and patients need to understand that. As you wear dentures, the gums continue to shrink, and over time more relines are needed. Sometimes it'll be a year, sometimes it'll be 5 years or 10 years, sometimes people's gums will change very, very slowly and they won't need them for many years. But certainly during the initial period when teeth are extracted, you get the most rapid change. So once the tissues are healed enough that you're not worried about the soft denture reline material from interfering with the initial healing of this tissue, then we can place it in to give the patient some comfort. So first of all, how are you doing with the denture right now? Are you having any sore spots?
No.
Okay, that's critical, because if she has sore spots right now, you have to relieve them and relieve them generously. The soft lining will make the denture fit, but if a spot is pressing, the soft liner will not compensate for that. It will still protrude through and press on that. So you have to be aggressive in removing anything that is pressing on her gum tissue. So you've gone for some time now, I guess, without any kind of sore spots on.
No, that's correct.
All right, let's just feel how this is here. Now we have lots of rocking, which is typical as that gum tissue shrinks. We lose stability. And let's see how your tissue is healing. Oh, and it's looking very nice. We have good initial closure of the sockets. Excellent. Okay. Now let's come on over here. Take a look. Erica, can you see the denture? Now, the soft liner is going to be thickest where the teeth were extracted. So we have this anterior section where the teeth were extracted. These areas, there was no changes. So you're going to place your soft liner thickest in that area. So let's show you how we mix this. We will use one of these little cups of the soft liner to 4 cc's of the liquid. It's kind of a honey-like liquid, and it's a little difficult to pour. You want to pour the liquid into the big mixing cup and pour the powder into the liquid, because you'll get less bubbles. The powder, as it settles into the liquid, lets the air sort of percolate through that. Now that's the recommended mixture according to the manufacturer. Being an impatient person, I always add a little more powder because that will make it set faster, make it less drippy, and the patient will not have as much run through. Looks very good, Jennifer. Don't pour that up. Let the lab pour that up, okay? All right. So I've mixed it. Trying to stir, not whip it. This is not like you're scrambling an egg and making it nice and frothy. You don't want bubbles to get in there. And if I see bubbles, I'm just kind of trying to tap them out. Now I'll pour it into the denture. Again, we're thinking about how thick I want this to be. But you want the entire surface covered, even though there's been no surgery on the palate or on the posterior part of the denture. You still have to cover it so there's no junction of this material, where you have material and there's no material. You want a nice, smooth transition. Now I'm smoothing it over just so that I have a thin layer in the places where I know it's going to be thin. And I'm leaving it thick in the anterior where I know it's going to be thick. And I'm letting it set up a little bit. You don't want it to be so runny when you put it in that it's real messy. All right. Alright, so you can see that it's no longer running, it's kind of gooey now. Just grab a couple of Q-tips are good to get any excess. Okay, for Joy, I'm going to seat this now. Now I'm seating it from the posterior to the anterior so that it doesn't run out the back, and I'm letting it flow up under her lip. See all that excess squishing out? I like that. Now, Joy, I want you to close your teeth together. And I want you to kind of rock it a little side to side. Good. Make it seated. Great. Closing in. Good. Hold it right there. Now, I've controlled the placement of the denture, and I've controlled the flow of the denture of the soft Reline material, and I've made sure it's seated. That's critical. You have to make sure that the person's bite is correct. If you have not verified that her occlusion is proper, it'll seat in a cockeyed position. It's not a permanent problem because the soft Reline is just a temporary measure, but it's going to be uncomfortable for the patient during that time. Open again for me. Great. Now I'm seating it in the back again just to make sure that's good close adaptation there. Close one more time. Now it's getting a little bit more seated. I'm going to more set. I'm going to do my border molding. Relax your lips, and I'm going to just pull down on her lips so that any muscle attachments are not impinged on by this material. So this is her lips and muscles are creating the borders. And of course that frenum usually creates a little notch in the front. Now the material has gooed up all over those teeth. We don't care about that. That's easily enough removed. Erica will show you as we trim it up. And that's it. Just stay closed on that. We're going to let that stay for a few minutes, and as soon as it gets to fairly set consistency, we'll take it out. Now this material is not like other materials because it never, of course, fully sets. That's why it's a soft Reline material. Unlike a temporary crown and bridge material where you're waiting for it to get rock hard, this never will get rock hard. It just has to be hard enough that when you take it out of her mouth, it doesn't distort. So if you see that when you push on it with your finger, it doesn't bounce back, that's not good enough. So usually 5 or 6 minutes or so is enough. And then if it was dripping out in the back, which this is not, open again for me, Joy. I would just go back here with the Q-tip, and I would just wipe it off with the Q-tip so that it doesn't run down her throat. And have her stay closed to that. Just keep some pressure on that, Joy. We're going to let you sit for a few minutes, and we'll come back and trim it up. Thank you.